Okay, hopefully you've got the right window there. My name is Hayley. I'm excited to be presenting to you all today. And my practicum placement was with the Healthy Public Policy and Strategy, or HPPS team within Island Health's population and public health portfolio. Island Health is one of 5 regional health authorities in BC, covering the entirety of the Vancouver Island region, as well as the Southern Gulf Islands. The HPPS team facilitates evidence-based policy development, supporting medical health officers, internal teams, and communities through research, knowledge translation, and engagement. HPPS uses an upstream approach, and they explore how narratives and framing and policy can be used for transformative cultural change. In this presentation, I will discuss dominant narratives and how they can be applied to alcohol policy specifically, and I will introduce my main practicum project. Before I go any further, I would like to respectfully acknowledge that I am joining you from the traditional territory of the Kautsin, Dididot, Halalt, Laxon, and Pakidat nations, where I live and work. So what are dominant narratives? Many of you will be familiar with this concept, but I will give an overview. Dominant narratives are stories and themes that reflect beliefs held by many people, often influenced by the dominant culture. Narratives, by their nature, are stories that can be emotionally compelling and feel intuitive to people, regardless of whether or not they contain factual information. This graphic is used by HPPS to help visualize interrelated factors when talking about dominant narratives. Worldviews or mindsets are the foundation, and these are values, beliefs, and assumptions about how the world works. Narratives are stories and themes that emerge from these worldviews, and they set the framing of how we see the issue, and they are the lenses through which we determine what the problem is. This can often ignore other sides and voices of the issue. Finally, we get specific messaging that is communicated to the public, as well as policies and actions. Here's an example of a narrative, the meritocracy narrative, where the assumption is that hard work will pay off and result in success. The worldviews that underlie this narrative are ones of individualism and equal opportunity, and are related to values of self-made individuals, which North American cultures hold dear. We have probably all heard related expressions about someone pulling themselves up by the bootstraps, or that we all have the same 24 hours in the day. This frames success as dependent on individual effort and ignores all other factors of success, such as privilege, systems, and even just pure luck. Messages that emerge from this focus on the individual and diminish unequal access. One policy issue the HPPS team uses the dominant narratives framework for is alcohol policy, because it is an organizational goal of Island Health to reduce alcohol consumption within their jurisdiction. Alcohol consumption is higher on Vancouver Island, especially in rural remote areas, when compared to the rest of BC. However, alcohol consumption has been increasing everywhere in BC over the past 20 years. Alcohol causes significant health harms, increasing risk of liver, kidney, and cardiovascular disease, as well as significantly increasing the risk of 7 different types of cancer. The new Guidance on Alcohol and Health, published by the Canadian Centre on Substance Use and Addiction in 2023, warns that consuming as little as 3 drinks per week carries moderate risk of health harms. Alcohol is shown in this guide as a continuum of risk that increases with increased consumption. Despite harms, alcohol is normalized in Canadian culture, and even heavy consumption holds less stigma than that of other substance use. Industry is a powerful agent in influencing both norms and policy. And many of the narratives we have about alcohol and health and public health approaches, including the new guidelines, are rooted in individualism. This places the responsibility on the individual to make healthy choices and ignores other factors, and this ties into my work on dominant narratives. If we turn back to our example narrative and apply this framework to alcohol consumption, we can see that by framing this through an individualistic lens and attributing the majority cause to personal choice or lack of education, we leave out the other determinants and causal factors involved in alcohol use. So why is this important? How we frame a problem informs how we find solutions. If we limit our understanding of the problem, it limits the scope of our solutions. We know that alcohol consumption has upstream causes, so these must be addressed. Related to this is equity. We need to ask whose perspective and voice is being heard in our framing of the problem and who is being left out. Narratives surrounding a topic can be a reflection of multiple factors, such as political tactics, industry influence, and public opinion. Within a time-sensitive policy window and for sensitive subjects, it is important to get the messaging right. Monitoring and analyzing dominant narratives can help public health professionals pinpoint what messages to strengthen or when counter or transformative messaging is needed. News media reporting can serve to amplify these narratives, giving them a platform. News media is a powerful agent in determining how information spreads to the public and how this information is framed. It can both shape public opinion and also be directed by it. With the assumption that news media articles represent dominant beliefs, I developed a content analysis method for monitoring emerging narratives and messaging. Choosing the topic of alcohol and a 6-month search window, I developed a structured search strategy drawing from databases and Google searches and a way to collect and store the data. The included articles were qualitatively analyzed based on Braun and Clark's 6-phase thematic analysis framework to extract themes and subthemes from specific messages. Then the themes and subthemes were subject to a quantitative analysis, which enabled us to see trends over time. These are some examples of the themes that we had in our search sample. Themes were categorized as either industry supportive or health supportive, and the majority of themes in the article determined the overall categorization of the whole article as either industry supportive, health supportive, or neutral. Themes were also broken down into further subthemes. Here is an example of a message from an article discussing the Premier's desire to modernize and liberalize BC's liquor licensing system. So the theme is culture, and the sub-theme, modernization and vibrancy. This theme of modernization emerged consistently across the majority of articles in the sample. This framed liberalization of alcohol policy as modern and normative and a way to inject vibrancy and fun into cities. Articles sometimes argued that public safety needed to be balanced equally against industry interests. Some other novel themes that emerged in the search timeframe in response to the US-Canadian trade war were consumption as patriotism and national identity. This project presented numerous challenges. First, the goal was to make a practical tool for the team, not design a methodology. For that purpose, the tool could not be too time-consuming or require too many staff resources. The database used needed to be publicly accessible. I choose Canadian News Stream, which is accessible with a public library card. However, the database wasn't a complete enough resource. News media outlets such as Global, CTV, and CBC are not included. So for this reason, a Google search should be done to augment results. But browser searches are affected by algorithmic variables, and therefore this really greatly diminishes the reliability and replicability of the search strategy. And because the Braun and Clark thematic analysis is meant to be a reflexive method, it is expected that any two raters will get slightly different results. However, I recommended to the team that analysis should ideally be done with a partner or small group to interpret and analyze themes. Educating individuals on alcohol health harms is only one small part of an effective strategy for alcohol policy. Reflecting on the root of our framing and staying aware of emerging narratives can inform how we talk about alcohol in our organizations and communities and how we approach alcohol policy. It can keep us aware of the public opinion and potential industry influences that motivate political will. Truly shifting away from individualistic approaches to alcohol policy requires cultural transformation and work on upstream determinants of health. I want to gratefully acknowledge the wonderful and welcoming HPPS team, especially my supervisor, Elise Kornhauser, from whom I learned so much. I would also like to thank all of my fellow supportive students in this cohort over the past couple years, and Dr. Mira Debar for her guidance and supervision. And thanks everyone for listening.